My own view that the two most important, or maybe two of the most important reforms in the healthcare law are, one, the establishment of large purchasing pools. We call them exchanges, and they'll be stood up in Delaware and across the country in 2014 for individuals, families, small businesses, middle-sized businesses who'd like to be part of a large purchasing pool to bring down their cost of healthcare. That's still to come. We're still beginning to see rolled out some of the changes that actually focus on prevention and wellness, where we incentivize people to take personal responsibility for their own health care. That is beginning to be rolled out already. But things that are deliverables, immediate deliverables, for folks who are Medicare eligible, who participated in the Medicare prescription drug program, they have seen their cost of medicine decreased dramatically. The so-called donut hole is being reduced in size, and it's saving lots of money, hundreds of dollars every year, and eventually thousands of dollars every year for the average Medicare prescription participant. We've seen for people who have children up to the age of 26 who really have no option for health care coverage after they left the roost, they're going to be covered. They are being covered, and millions of them now being covered for health care under their parents' health care plans. We've seen for folks that are on Medicare, for example, the ability to get preventive screenings for whether it has to be for colonoscopies or mammograms or prostate screenings. It used to be that there was a big copay that the senior citizens had to pay for those. Now, Medicare person, they just participate. They get that for free. We do that because it saves money in the long run. And lastly, when I was in the Navy for all those years, we got every year an annual physical on our birthday month. Mine was January for 30-some years, annual physicals. Still get them. And the reason why we invest that kind of money for annual physicals is because it saves money in the end. Now, Medicare participants are able to get an annual physical paid for by Medicare for however long they live, every year. Previously, it was one, you got one, where if you lived to be 105, you'd only get one of those. Now they can get them for the rest of their life. In the end, that's going to save money. It already is.